Hi, I'm Dr. Melissa Toyos, ophthalmic and oculofacial surgeon of Toyos Clinic. We have locations in Memphis, Nashville, and New York City.
And I'm Sjögren, makeup and hair artist, and I'm here to do a simple makeup look for Dr. Toyos.
Joel, I'm so excited to do this today. I'm ready to let go of my lockdown look.
And Melissa, I'm here to help you with that lockdown look, and we're gonna do a simple look for you.
I haven't had my makeup done in so long.
Well, I'm excited to do it for you and to help you with some new ideas.
So in addition to our makeup look today, we're also partnering with RVL Pharmaceuticals to talk about something that I see a lot in my clinic with my patients, and I think you see it too in your work.
Tell me more, I'm excited to hear about it.
So I want to talk about droopy eyelids. The technical term for that is acquired blepharoptosis, and acquired ptosis is a condition that causes your eyelids to droop. It's actually a lot more common than most people think, and I've asked you here today to be with me to tell me about your clients when they have droopy eyelids when they're sitting down in your makeup chair.
That sounds amazing, because actually just the other day I had a client ask me about techniques and ideas for makeup to help with the droopy eyelid.
See, like I said, it's really common. So I want to talk a little bit more about what ptosis is in depth, how people with ptosis see themselves, how it affects their image, and what the options are to treat that. So a lot of people don't know that there actually are non-invasive ways to treat as well as surgical.
Dr. Toyos, I'm so excited to hear more about this.
Specifically, there is an eye drop called UPNEEQ, oxymetazoline hydrochloride ophthalmic solution 0.1%, and it is the first and only FDA-approved eye drop for adult patients with acquired ptosis.
And Dr. Toyos, I can't wait to hear more about this.
Great. So while you were working your magic on my face, I'd like to ask you a few questions about the clients that you mentioned.
Sure. I've had several clients that always ask me about droopy eyes and a heavy eyelid.
Yeah. How do they phrase that to you? What are the concerns that they specifically speak about?
Most of the time they just lean in and go, "Can you help me with my droopy eye?"
Right.
And I say, sure. There are things that I can show cosmetically to do.
Yes, so between us, we have a range of options. You've got the aesthetic way to handle that, and you're going to go over some of those tips and tricks in this video. And then we also have surgery on this end. I do a lot of surgery for oculoplastics. And now we have UPNEEQ.
And UPNEEQ sounds like a really great product. While we're going to talk about the makeup idea, I also want to mention that I also have the women that come in and they ask about their husbands with the droopy eyelid as well.
Do you feel like it's more women or men, or more equally based?
I think that men are less likely to bring it up. I think that they rely on their wives to bring that to the table.
Right.
Because they don't really want to talk about it, because men are probably a little more vain than women in that respect.
Interesting perspective. And do you feel like you see older patients with droopy eyelid? Do you see younger patients? What's the mix?
I think with younger patients, it's probably the idea that they've been exposed to so much with computers and lights and things that it's kind of created that almost droopy eye, and they're tired because they do 12,000 things. The mature client mentions it probably every time.
Wow. My patients come to me telling me that they feel like they look tired and they don't feel like themselves when their eyelids are droopy. What do your clients tell you when they are complaining about their lids?
When we talk about the droopy eyelid, they just want to make sure that there's something cosmetically that I can do to make them look less tired and to make their eyelid appear more open.
So what are the tips and tricks? What do you do to actually accomplish that in the makeup chair?
Cosmetically, the little things that you can do is you can take your brush, and while you're looking at the eyelid, you can go just above the eye and just above the fold. And you hit a little bit of eyeshadow and you rock that back and forth, remembering to pull in an up motion, hence UPNEEQ. And do that up motion so that you're lifting the eye instead of going left to right and knocking down the eyelid, which would increase that droopiness.
So not the windshield wiper that
Correct.
we all learned in
Well,
seventh
this
grade.
isn't a windshield wiper because we're trying to pull the eye up. So we want to go into this corner, not exceeding too far out, and pull that shadow and pull it and buff it into the center just above the eyelid.
Those are some great tricks. I'm going to start using them actually immediately at home. Makeup is not a definitive cure, but it is really great to have those in your back pocket to know how to deal with droopy eyelids, especially if you're pairing that with UPNEEQ.
I think that using those techniques along with UPNEEQ would be the great combination.
I agree with you.
Dr. Toyos, I never knew that acquired ptosis was an actual condition. Can you explain to me a little more about what ptosis is?
Right. Yeah, so ptosis literally is the Latin word for droop. And when we talk about acquired blepharoptosis, what we're talking about is the lid, the upper lid, actually beginning to sag or droop. I see this a lot in people that are aging normally, but I really see it across all age ranges.
So, Dr. Toyos, who can get acquired ptosis?
That's a great question, Joel. So ptosis is normal in aging adults. So we see that definitely in the more mature group that you were speaking about before, but truly we can see it across all age ranges for a variety of reasons. In my practice as an eye care professional, it's important for me to screen those patients for other medical conditions like neurologic problems that could also cause ptosis before prescribing UPNEEQ.
So what can people do if they have acquired ptosis?
It's been tricky up until now. So really, eye care professionals only prescribed surgery when the ptosis became really severe for patients. But now we have an option in UPNEEQ that allows us to treat patients with mild, moderate, and severe ptosis.
So can you tell me a little more about UPNEEQ?
Absolutely. So UPNEEQ is a prescription eye drop that works within minutes of application. Patients use it once a day in each eye that has acquired ptosis.
Just one drop a day. That sounds like something that's so easy for someone to work into their skincare routine. Can you tell me how long it takes for it to work?
Yes, it literally just takes a few seconds of your day to have lifted eyelids for the rest of the day. And if you have severe ptosis, it can actually improve your field of vision, your peripheral vision.
So are there any side effects from using UPNEEQ?
As a medical professional, I always evaluate my ptosis patients to make sure that UPNEEQ is right for them. I also tell them about potential side effects. Common side effects include eye inflammation, eye redness, dry eye, blurred vision, installation site pain, eye irritation, and headache. In clinical trials, UPNEEQ was proven to be safe and effective when used as directed.
What's the one thing that you would tell patients with ptosis?
The one thing I would tell patients with ptosis is that you have options. Ask your eye care professional about all of the available treatment options. Your doctor can evaluate you to determine the cause of your droopy eyelids and whether you may be a good candidate for UPNEEQ. Your doctor can also discuss with you the benefits of treatment and potential side effects.
Once someone has been prescribed UPNEEQ, how does one go about getting a regular prescription?
Right, so once your eye care professional determines that you're a good candidate for UPNEEQ, you can either pick up UPNEEQ at your doctor's office or through the RVL pharmacy.
So in your opinion, what is the beneficial part of getting a patient with acquired ptosis on UPNEEQ?
The thing about moderate and severe ptosis is that it can impact your vision. By lifting the eyelids, UPNEEQ may improve the daily functions like field of vision, as well as enhance the appearance of a lifted eyelid. Joel, I love the look you did for me today.
Thank you. It only takes about 10 minutes, like I said, much like using UPNEEQ. So for diagnosed patients, do you typically recommend UPNEEQ for their daily routine?
Absolutely, and you make a great point. UPNEEQ is one drop once a day. I recommend that my patients work it into their morning routine to get them started for the day.
And much like your skincare and beauty routine, once you get used to using UPNEEQ, it just becomes second nature.
It really does. Thank you so much for everything you've done for me today. This has been really fun to talk to you about ptosis, and I hope that next time you have your celebrity clients sitting in your chair that are concerned about their eyelids, you'll direct them to their eye care professional to consider UPNEEQ.
And thank you, Dr. Toyos. I look forward to speaking to my eye care professional and chatting up my clients about UPNEEQ.
You can learn more about acquired ptosis, UPNEEQ, and important safety information at www.upneeq.com. And as always, be sure to talk to your personal eye care provider for more information and to determine if UPNEEQ may be right for you.
Important safety information. What is UPNEEQ? UPNEEQ, oxymetazoline, hydrochloride, ophthalmic solution, 0.1%, is a prescription eye drop used to treat low-lying lids, acquired blepharoptosis, in adults. What warnings and precautions are associated with UPNEEQ? Low-lying lids may be related to conditions such as stroke and/or brain aneurysm, Horner syndrome, myasthenia gravis, loss of the ability to move eye muscles, eye infection, and eye tumors. Ask your doctor if you have any of these conditions. UPNEEQ is a type of medication that may affect your blood pressure. If you have heart disease, uncontrolled high or low blood pressure, or feel faint at rest or when quickly standing up, you should call your doctor if your symptoms get worse. Patients with reduced blood flow to the brain or heart, or patients who experience eye or mouth dryness due to an immune system disorder, Sjögren syndrome, should use care when taking UPNEEQ. Call your doctor immediately if you feel your symptoms may be getting worse. UPNEEQ may increase the risk of eye pressure due to fluid buildup, angle closure glaucoma, in patients with untreated narrow angle glaucoma. Call your doctor immediately if you feel increased pressure in your eye after using UPNEEQ. Do not let the tip of the UPNEEQ vial touch your eye or any other surface. This can help prevent eye injury or contamination. Each UPNEEQ vial is for one-time use and should be discarded after being used. What are the most common side effects of UPNEEQ? The most common adverse reactions with UPNEEQ occurring in 1 to 5% of patients were eye inflammation, eye redness, dry eye, blurred vision, eye pain at time of use, eye irritation, and headache. What should my doctor know about before prescribing me UPNEEQ? Your doctor should review your full medical history before prescribing UPNEEQ. UPNEEQ belongs to a class of medication, alpha adrenergic agonists, that may affect your blood pressure. Use UPNEEQ carefully if you currently take an alpha adrenergic antagonist medication to treat heart disease or an enlarged prostate. Patients taking beta blockers or other medications to treat hypertension or an abnormal heartbeat should also be careful when using UPNEEQ. Patients who use a certain class of antidepressant medication, monoamine oxidase inhibitors, should also be careful when using UPNEEQ, as it may affect the way your body absorbs the medication. These are not all of the possible side effects of UPNEEQ. Tell your doctor if you have any side effect that bothers you or does not go away. Call your doctor for medical advice about side effects. To report side effects or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report side effects to the FDA by calling 1-800-FDA-1088 or visit www.fda.gov/medwatch. This document has summarized the most important safety information for UPNEEQ. For more in-depth safety information, please review the full prescribing information for UPNEEQ.